we will talk about gastric inflammation called gastritis, including the top 5 signs and how to detect, diagnose, and treat it effectively. Gastric inflammation in different severities affects a significant portion of the population because the bacteria that cause it infects 50% of the world's population. Stress also causes gastritis because during stress hormones activate the vagus nerve, which stimulates gastric acid production. Increased gastric acid causes inflammation of the gastric lining. This is why many people experience stomach pain during stressful situations. The first and most common sign of gastritis is stomach pain, which occurs just below the ribcage in the middle upper part of the abdomen. During gastritis, stomach pain typically occurs on an empty stomach and is relieved after eating. When you eat, the food temporarily neutralizes the acid and buffers the stomach lining, providing relief. The pain is usually moderate and described as a gnawing, burning, or aching sensation. The second most common sign of gastritis is nausea and vomiting. Nausea is a feeling of queasiness or an urge to vomit and can occur with or without vomiting. Vomiting usually happens after eating, and nausea can be present throughout the day. The third most common sign is bloating. A person feels fullness or swelling in the abdomen, an uncomfortable sensation often accompanied by belching. Gastritis causes inflammation of the stomach lining, which can slow down gastric emptying. This delay means food stays in the stomach longer, leading to a feeling of fullness and swelling. Additionally, the prolonged presence of food in the stomach leads to increased gas production, which needs to be expelled, leading to frequent belching. Belching can also be caused by swallowing air during eating. Also, gastritis causes loss of appetite due to slow gastric emptying. The most common cause of gastritis is a Helicobacter pylori infection. The second most common cause is the regular use of NSAIDs like ibuprofen, aspirin, and naproxen, which can irritate and erode the stomach lining, leading to inflammation. The third most common cause is frequent alcohol consumption. Stress and certain foods also play a role, such as spicy foods, acidic foods like tomatoes and citrus, and alcohol, which are